When Alzheimer's disease begins after age 65, it's considered late-onset Alzheimer's disease. It's the most common cause of late-onset dementia and is most often characterized by problems with short-term and long-term memory. Alzheimer's dementia stems from a buildup of toxin proteins in the brain that causes the death of nerve cells and interferes with communication between existing nerve cells. There is currently no cure for Alzheimer's disease, but there are treatments and lifestyle behaviors that may help slow its progression. Late-onset Alzheimer's disease is defined as Alzheimer's disease that develops when someone is 65 or older. The brain changes that lead to late-onset Alzheimer's start occurring years before the first symptoms appear. Alzheimer's disease that develops before 50 years is called early-onset Alzheimer's. Only about 5% of people with Alzheimer's disease have early-onset Alzheimer's, which usually develops when someone is between ages 40 and 50. Though people may also develop Alzheimer's between the age of 50 and 65. Late-onset Alzheimer's disease is the same disease as early onset, and there is no clear risk factor or test that explains why some people start having symptoms later than others. In the earliest stages of late-onset Alzheimer's disease, symptoms tend to be limited to memory problems and confusion. People might get lost driving on familiar roads or forget doctor's appointments or deadlines to pay certain bills. They may use poor judgment and have difficulty making plans and decisions. Symptoms of late-onset Alzheimer's disease are progressive and may affect memory as the disease progresses. Memory problems can become more sudden. A person with late-onset Alzheimer's might ask a question that was just answered moments ago or repeat a story within a short amount of time. Sensory changes also start to take place. For example, someone with Alzheimer's disease may not be able to identify certain familiar scents or tastes. Recognizing faces and voices may become inconsistent. Later on, personality changes become more obvious. A person with advanced late-onset Alzheimer's may not recognize family members, or they may insist relatives or friends who have passed away are still alive. It's also common for someone with advanced Alzheimer's to become easily agitated, anxious, or aggressive. Sometimes these changes are due to fear and frustration and their inability to remember certain people and events or understand what's going on around them. The primary causes of Alzheimer's disease, no matter when it develops, are buildups of two proteins in the brain, tau and beta amyloid. The protein tau forms tangles between brain cells, neurons, making communication and signaling between the cells more difficult and eventually impossible. The protein beta amyloid forms plaques or clumps within neurons, destroying the cells from within. There also appears to be a genetic component to Alzheimer's disease. The condition tends to run in families. So if you have one first-degree relative with the disease, your chances of having it one day are increased. Research suggests that a type of APOE gene has the strongest influence on person's risk of developing Alzheimer's disease. Everyone inherits some form of the gene, but the APOE4 gene seems to have the biggest impact. It may be present in up to 65% of individuals with Alzheimer's disease. As late-onset Alzheimer's progresses, individuals become less able to take care of themselves. Most people with a moderate or severe form of the disease require around-the-clock care, usually at a skilled nursing center or similar facility. Late in the disease's course, complications that impact an individual's health develop, such as bladder and bowel control, difficulties chewing and swallowing, loss of interest and motivation to eat, malnourishment, pneumonia. Pneumonia is a common cause of death for people who have Alzheimer's disease, as difficulty eating and swallowing fluids can lead to fluid buildup in the lungs. Treatment options for Alzheimer's disease are limited. There is currently no cure or treatment that can reverse the course of the disease. There is also no vaccine or other reliable means of preventing it. Two new medications, aducanumab and lecanemab, have recently been approved to treat Alzheimer's disease. They work by clearing beta amyloid plaques from the brain. They are not considered cures, but they may at least slow cognitive decline associated with Alzheimer's disease for some people. Research into other drugs to treat the disease is going on around the world. The timing of Alzheimer's disease progression can be hard to predict. The condition is often categorized into 3 stages: mild, moderate, and severe. The time a person spends in each stage differs, but in general, a person lives 4 to 8 years with Alzheimer's disease after diagnosis. That number can be as high as 20 years, according to the Alzheimer's Association. If you enjoyed this video, subscribe, share, like, and comment.